your sound's very. Oops, no, don't start the recording. Yes, one moment. Yes, this is Doug McCall, the International School Health Network. Welcome to our first session with our regional network from Europe. Very pleased to be welcoming our panel members here today, which include Hof Bus from the Schools for Health in Europe. Hof is the director or the coordinator of that organization. We're going to have a presentation from Sarah. Forgive me my pronunciation, but Katrin from the Children of Armenia Fund, who is the director there, followed by Adina Malkik, who is the director of the International Association for Open Schools, and then finally Chris Jones, who is the director of the International Center of Excellence on Community Schools. All of our panel members have agreed to take on a relatively unique topic, I think, in looking at the context of middle-income countries in Eastern Europe and Central Asia, trying to get a handle on how the context of those countries, not that they're all the same, there are similarities and differences from country to country as well as from community to community within those countries. But we're trying to engage in a conversation around how community context, country context has an influence on our health and social development programs. And so I really thank our four speakers today for embarking on a bit of a new step for this particular session. As I've noted earlier, the session will be recorded, and we found that many people go to the recording at their leisure on their own schedule. And we've verified that through the numbers from the web pages going in. So we're looking forward to having, well, in this particular case, we invited over 400 people from the European region who are active in healthy schools, community schools, safe schools, development through schools, and a variety of other human development approaches to schools. And so, as we were talking earlier, several of us have had a very positive response to this idea of a networking within Europe. Not a big, huge network, just a network that meets 3 or 4 times a year by webinars and follows through a couple of other web-based tools. So we're going to begin the session with Hof making some introductory remarks, followed by Sarah, and then Indina, and then Chris. Hof, if you wanted to start us out, yes, that would be great.
Thank you very much, Doug, and thank you very much for taking the initiative for this series of webinars, and I'm very excited to be part of that. I think the issue that you have put on the agenda is very relevant and important for, at least for my work, and I was in the happy circumstance to get the invitation when I was working in Armenia with Sirap, my good friend, who will be the next speaker. So we were even able to do some preparation work there and then in Yerevan, which was great. So yes, I will say a few words about what the SHE Network specifically does for supporting health-promoting schools in Eastern Europe and Central Asia. And that's the first slide. The SHE Network has its secretariat at CBO. That's, for most of you around the table, a relatively new organization. CBO has hosted us since last year when our previous organization, the Netherlands Institute for Health Promotion, went bankrupt. And CBO is part of TNO. TNO is the biggest public research organization in the Netherlands, and CBO is hosting us and are now in the process of becoming a World Health Organization Collaborating Center for School Health Promotion, which is what we were at the previous organization as well. The SHE Network is a member network in 43 countries in the European Union and in the Eastern European and Central Asian countries. The network has a membership of national coordinators. These are people who have been appointed by their Ministry of Education and the Ministry of Health. And they are the persons who are usually responsible for their national health promoting school program in the country. And since 2007, we also have a research group which now consists of about 65 researchers from highly expert research institutes, from public health, from health promotion, and from education, which is a very exciting new development, I think, for the research development in the network and in general for health promoting schools. The network is a very old network, I would say, more than 20 years old, and always had the support from the World Health Organization, the regional office in Europe, also by the Council of Europe and by the European Commission. And our main focus is that we are making school health promotion an integral part of policy development in both the education and the health sector in our member countries and in the European Union on the EU level. This is a picture of our members. The European region is very big, as you can see, ranging from Iceland to Vladivostok, and from the top of Norway to Israel. Israel is also included. So we have a very big area to cover, as you can see. I want to focus my presentation on the Eastern European and Central Asian countries. At the moment, there are 13 countries from this region who are a member of our network. So in all of these countries, we have an acting coordinator. Albania, Armenia, Croatia, Georgia, Kazakhstan, Kosovo, and Kyrgyzstan, Macedonia, Moldova, Russian Federation, Turkey, Ukraine, and Uzbekistan. Sorry for the typing error. In the other countries who are also Central Asian and Eastern Europe, we are working hard to establish our contacts. In the SHE network, we use a definition or description for health promoting schools that focuses very much on, it's not a project, but it's a policy. It's a structured and systematic way to health and well-being, so a very broad definition. And we'll look at both students and school staff. So we take it very wide, and it's not only healthy eating and physical activity, but very broad, including mental health promotion. So when I look back, because it was a nice moment to reflect on what we do actually in the eastern part of our network, because a lot of our work focuses on the European countries who can get funding from the European Union. And I think when we started the network in 1992, in the late 90s, it was so that the health promoting school concept was timed. The timing was very well. It coincided with becoming independent. The Soviet Union collapsed, so there were suddenly very many countries who became independent. It was quite easy for most of these countries to recognize the health promoting school concept that we have developed in our first European conference in Greece in 1997. And we have concepts like democracy, empowerment, engagement, and these concepts went down very well with our contacts. Another issue is that there are very big and huge health and well-being issues among children and adolescents in this part of our world. So it was seen that health promoting schools could be an excellent entry point for school improvement and also educational reform. I found also that since the Soviet times, schools have many schools are in a bad condition, just lacking facilities and all the rest. So these are all factors that I think promoted the introduction of health promoting schools. This is a picture that I took when I was in Kyrgyzstan, in the capital, Bishkek, on one of the health promoting schools there. And this is how I was welcomed in traditional, children in traditional clothing, offering me bread as a tradition and salt. some of you who might have been in these kind of schools recognize this. Kyrgyzstan is really Central Asia, close to the Chinese border. And well, I won't go into details of the different countries, but in general, I can say that the support that we offer in the network, which has been under my responsibility since 2007, that we've organized every year a capacity building workshop for the coordinators from these countries, which has been a very, very good and supportive tool. Then a lot of country visits were made, which was mainly for strategic development of health model schools. We also were in the opportunity to translate some of our key documents from health model schools, mostly from European projects, into Russian language, which made the access to these documents much bigger, of course. Then we also organized many national workshops and training workshops to introduce health model schools or to work specifically on specific health issues. Finally, we also promote exchange among the coordinators. We are trying to develop a structure for that with the Russian Federation playing a key role. And finally, we offer financial support sometimes. And by the way, the money we can do this from is from our funding from the World Health Organization that we receive annually, at least till this year. We're not sure about next year's. Issues that we found in the ECA countries concerning health model schools are the recognition of specific needs in these countries for health model school development, and it's important to know these needs. We also found there is a huge need for sustainable national programs on health and well-being. The countries always indicate that they would like better links with funders, both from the national sources and international. Partnerships development is very important, especially between education and health sector. And an issue that plays also is how health model schools can be really secured in the Ministry of Education. This was how I was received in a school in Armenia, in Lernagok School, which I'm sure that Serap will speak about this region. Some of our future plans are that we will continue our technical support to the countries. I think we'll have a more growing focus on reducing health inequalities. This will also be addressed in Pattaya and in some other international meetings. I think it's very important how we can focus on sustainability of the programs in the countries, and also how we can introduce and develop programs on specific health issues. That's mainly health eating, physical activity, mental health promotion, but also hygiene, sexual health, are issues that come back all the time. And finally, I found kind of very interesting issue is how we can link health model schools with community development. And that's where I think is my hook to Serap's presentation, because that's where Serap and I got very involved with and talking with since last year when we met in Armenia for the first time. So Serap, I'm happy to give the floor to you, unless there are comments or questions from those of you around the table.
We'll come back to the questions at the end of the four remarks.
Okay. Sorry. Okay, that's good. Thank you, Doug.
Thank you, Hoff. That was a great beginning. Thank you.
Thank you.
Serap?
Yes. Thank you very much, Hoff and Douglas, for giving us this opportunity to present works of Children of Armenia Fund, which is working in Armenia. First of all, I would like shortly present our foundation. Children of Armenia Fund was founded in Armenia in 2003 by Dr. Garo Armen, who is diasporan Armenian from New York. And we operate in 11 neighboring villages located in Armenia. And we are raising our funds through fundraising events in the US and Armenia. Also, we work with international organizations, getting grants from different partner organizations, and also we work with local corporations and businesses on different projects. Let me give you a short information about our vision and belief. One of the core values for Children of Armenia Fund is holistic development of rural communities, and we strongly believe in holistic development, and we think that in community life all fields are interconnected, so that's why we stress very much holistic approach rather than fragmented development. And the other more important value is that we really believe in human and social development, because in current world these are the movers of development. So as a representation of our holistic approach, we do 5 programs. Infrastructure renovation, which means renovating schools, health clinics, community centers, doing renovations of water pipelines, so all infrastructure existing in the villages. We do health programs, education, child and family services, and also economic development. Here I would like to mention one of the important sayings of famous British historian Arnold Toynbee, who said that the 20th century will be remembered as an era when the global community dared to see the well-being of the human race as an achievable goal, rather than one marked by its political conflicts or technological inventions. It's very important that currently we are trying to think about well-being of every person living in the communities, and in this sense, we think that a healthy and educated population is a public good. I would like here to present our approach. As I told, we are working in the villages, and in the villages schools are the main institutions, and we try to stress very much on schools as transmitters of innovative knowledge, and that's why most of our health programs, psychosocial programs, economic programs, all of them are very much concentrated in schools, and also we think that schools are the future of our society, so we work very closely with the schools. Second important thing is that we work with children as resources for change. We see huge capacity in children as change agents. Children are very flexible, very smart, and they really are very important supporters for us to make this change happen. And the third important thing is that we are trying to move people, because in current world it's very critical that people cope with changes and become more flexible, innovative. And here I would like to bring the words of American writer Daniel Pink, who said that education and medicine are becoming the most growing industry in 21st century because they are kind of moving people to a better life, to a more developed society. And also the words of American teacher Larry Ferlazzo, whose approach is very in alignment with co-op works. We are trying to move people in a sense that at the end they can move themselves. So because we are not going to stay in these villages forever, so we are trying to build this sustainability in the villages. When we started to work in the villages, we had lots of challenges, and there was a lack of water and poor sanitary hygienic conditions, unhealthy lifestyles, absence of doctors at schools. Our national school curriculum is mostly academic, and mostly teachers are working on transferring knowledge on physics, chemistry, history, and actually health, well-being. These types of values were neglected. And also a very small culture of cooperation between schools and family. I would like also mention 4 important things for co-op where health and education are meeting each other. The first one is creating healthy physical environment, doing participatory health education, implementing healthy practices like nutrition, physical activities, and children's annual checkups. So let me here mention concrete and specific steps that we are doing. First of all, creating healthy physical environment. And here you see the first brushadrome in Armenia, which is a toothbrushing station where children from the school are doing activities every day. Another important step is that we are building local capacity, and currently we are training local health educators who are going to support us in the villages. Another important step we are implementing now is encouraging local initiatives, and our schools who are part of health promoting schools are getting small grants to implement their ideas. This is an important asset for us because we want our village people to be more proactive and come up with creative ideas. Another important step we are doing is breeding activities. Actually, we are implementing Goldie Hawn's Mind Up project, which is an important activity for physical and mental health. And this activity is very effective in poor villages because it doesn't require any financial investments. Also, we have after-school clubs which are conducted by local teachers. Our students are doing public policy research projects, and actually last year the topic of public policy was community health issues, and they made presentations on this topic. We do also summer schools in health promotion, where students and teachers work with specialists, and they do different health activities. We encourage very much sport activities. We have different sport clubs. After school, we are organizing inter-village tournaments in the villages. Also, we are implementing nutrition programs, which are also very important because, unfortunately, there is a lack of breakfast culture, school lunch. There are also school lunch issues. So currently, we are actively implementing nutrition programs in our schools. We do also trainings for children on adolescent health, nutrition, dental hygiene, and different other topics. One of the important points for us is peer-to-peer education. It's interesting that children and community members who are participating in different educational activities at the end, they are starting to transfer their knowledge to other people, to the villagers. So here we are kind of having a ripple effect of our works. We are also doing awareness programs on different health topics. Social emotional learning programs are also very critical for us. We have, as I mentioned, we have Child and Family Service program, which is very actively working in the schools. In all schools, we have school psychologists, we have social pedagogues, we have social workers who are actively working with the children, teachers on social and emotional learning. And also we do children's annual checkups. In this picture, in this photo, you see this process of fluoridization of children. We have serious problems in our villages in this field. When we started our programs, I will say around 90% of children were having tooth decay problems. So that's why now we are actively implementing this program. And also last year, our schools joined European Network of Health Promoting Schools, and currently we have five schools in our region. And as Hope was mentioning, we are very actively cooperating with team and actually with other schools in the country. Overall, we have 10 schools in the country who are actively participating in this network. So this is the very short presentation of our health education activities. And again, I would like stress the idea that we think that having a healthy population is critical, because only healthy children can learn well, can work well, and express their talents well. So with this, I will finish my presentation. Here is the website of our organization, and we are welcome for any type of cooperation and communication. Thank you very much.
Thank you, Sarah. Adina, can you open up your mic and describe your experiences in a different part of Eastern Europe, and then Chris will follow up with that. Adina?
Okay, thank you, Doug. In the beginning, I would like to say my name is Adina Malkic, and I represent International Association Interactive Open Schools, and we work in Bosnia and Herzegovina and partly in Croatia and Serbia through our partners that are doing the same thing in their environment. Generally, we are promoting community schools development, support of the community schools in our area, and we provide services on 3 levels: with school management, with the teachers, their competencies and in teaching process, and we provide programs for the students in a way, some combination between formal and informal education. Mainly we provide trainings, advising process, we provide some funds for the schools in a way to develop open community schools, and we also provide networking on local but regional level as well. And within this international team, we also provide international connection and networking with the schools. Generally, we are promoting, as I said, community schools, and we have a lot of open questions which community schools deal with. And all framework or the guidance for us and for the schools in this process are the standards for community schools, which are developed and give very practical instructions and definition how schools in different parts of quality fields should be developed. And in our program and our approach, of course, the focus is on the children. But since we mostly work with the adults, sometimes children are lost from our focus, so we always have to bring them back and focus them on children in school, but also in the community. Through my presentation, I will shortly go, like Doug suggested with these questions, what can I say about my country and educational system. And for the beginning, I must say it was very hard to find strength, which is not good. We always have to look things in positive way and through these strengths develop further. But generally, we have a lot of natural resources in the country, but as well a social capital to make changes. We also have good laws in area of health, education, and social protection of children, which are good, but when we come on the field, sometimes these laws or procedures are not so much followed or respected or implemented within the community or the country. What is the characteristic of Bosnia and Herzegovina, and probably everybody knows that, is that we are still in this picture of war, which happened 20 years ago. And through this picture of the war and reflection, we have a lot of issues in educational system. Most of them is that Bosnia is divided by the Dayton Agreement on entities and cantons, and based on that, we don't have a lot of information or input or overview what is happening in whole country. That is fragmented in the way and used by politicians to manipulate everything else in the country. Still, we don't have a clear decision or clear vision how we will make our how we will interpret the past, the war, and what happened during the war. So that's a huge problem for our schools. And of course, unfortunately, issue of nationalism in school took a great part, which is also used by politicians to plan and do their plans in the country. And how this is reflected on education, it's very, the reflection and the consequences are scary. I would say, I would use the term scary, because somehow we are stuck in the moment, and when you have constant changes in the government and you don't have agreement about basic things in educational policy, for example, then you don't have a clear vision what will happen in the future. And consequently, you cannot really plan good strategies how to deal and how to develop educational system in further. So we saw our possibility to, unfortunately, possibility to give support to the schools and the children, students, through our approach. So we are doing our best, and although we are working in didactical way, pedagogical way, we also through needs assessment, we noticed that our schools need a lot of knowledge and a lot of support in terms of partnering with outside external partners. Also, this issue of social inclusion in a wider way, it's also very challenging for us. And with this political situation and the presence of the politics in the school, issue of leadership is now quite actual because headmasters are changing sometimes on a daily basis, which gives great consequences in school development in terms that these things are not happening that we are trying to develop. So we have to rely on the teachers and their motivation and strength to develop some good environment for the students to learn, to live, and to be positive toward the future in our country. In question of urgent priorities for our educational system, as I said, we have divided schools, lack of information, different parts of the country have different vision of educational system in the future. We have a lot of politics in our schools. Then we come the question with teachers' competencies, pre-service and in-service competencies of the teachers, and nationalism, which is quite very present in some parts of the country. These are, let's say, one of the priorities for our country, as well as harmonization of a national curriculum, which is supposed to be unique for whole country, but at the present time it's not. If we look on the school level, as I said, this partnership, leadership, social inclusion, and parental engagement are quite challenging for the schools. But since systematically some things are not sorted out, then it's understandable that schools also have a lot of questions in their mind in coping with the problems that they face today with the parents and students and community around them. When we speak about social and health and economic challenges, unfortunately I have to say poorness, then unemployment in the families, inequality in education, changes in the structure and the function of the family are the biggest challenges, and that definitely reflects on the education, which really sets the question what to do in order to make these things, we cannot eradicate these things, but we can influence on making them smaller challenges in the future. So we have this kind of situation in schools that teachers are complaining that parents have to work or seek for the employment. They don't have time for their children. We have to think about their health, their problems in the community, problems with the food and everything, which is the reflection of problems that we have in the country. We have situation that the grandparents now are caring for the children because parents have to go to Iraq or Afghanistan to work there and provide at least basic things for their families to live, to have any kind of a living standard in Bosnia and Herzegovina. So these are some of the challenges. We also, I was trying to find some statistical information in order to bring some, to present you a little bit closer situation, but unfortunately I have data from 2007, and I'm sure that these data are now worse than they were in 2007. But for example, now we have this situation that 20% of the children is with obesity, or 1.5% of the children are hungry. I don't know the English word for that. Then we have, let's say, in the area of reproductive health, 35% of the women use some kind of protection, but 11% of them don't use any kind of protection. And we are witness in elementary schools now that we have youth pregnancy, and nobody speaks about that, and parents are left alone to deal with this kind of situation in their families. In terms of child development, we don't have 75% of the adults somehow promote safety of the children, and these data are different for different parts of the country, but 75% is some average percentage. Then in terms of education, only 6.5 children in Bosnia and Herzegovina attend to preschool institution, which is quite worse. Not good situation. And there's a difference between rural and city areas. The better situation is in city areas. Then 90% of the students are in elementary schools involved in education, and the rest is mainly the minorities like Roma children, which we have strategy on country level, but still we don't have some progress on the field. And these are some data, but they are not really they are not from this side, so I cannot say these are the official data because of the division of the country. Everybody has different kind of statistics in that term. And when we talk about approaches and programs, how to work and how to use the best from the context in order to enhance our education, this is also a very tricky question because of country's division. Everybody has its own vision how to do it, and we are witnessing now constant changes in the government, and the new government, new visions, new people, new visions. So every time you have to start from the beginning, which is quite frustrating, at least for the NGO. So in that way, we see community schools as an approach or program, holistic program, that can help schools with enough skills to deal with the issues that I already named, in a way that they provide resources, or they provide some trainings, or they provide space for the community to work in. As the first presenter said, in rural areas, schools are really the place where living is happening. And we are trying, based on that, we are always trying to start the communication and conversation with the possible partners, first schools and then other partners in the community. I must say that we mostly work in the schools, trying to open them toward community, and showing them that they are not only a responsible party or the side to work on these issues. They have to involve people, institutions, everybody who can contribute in solving some of the problems that we have on local level, and through this, I think, through time, changes will arise on much bigger, higher level. So, I have a lot of information, but for the beginning, that is the context in which we are working here in Bosnia. And more or less every NGO or civil society organization have the same problem or same challenge, let's use the word challenge, which is not very motivating, but that's why I said children are the focus, and it's worth to invest your energy, your skills, and make synergy between the people in order to make the possibility environment for the children better. So for the beginning, I also will be happy to answer to all questions later, and maybe some other issues will arise. So for this part, that's about that from me. Thank you.
Thank you very much, Adina. And to finish up the initial remarks, Chris, do you want to add your thoughts?
Thank you very much, Doug, for inviting me to participate in this. I've really enjoyed listening to everybody's contribution so far. And what really strikes me is how we are all working in the same direction, how there are there's so much common ground between us, and how much, if we can find ways of collaborating, we can strengthen what we do and build much stronger schools in the countries that we're working in. So I'm delighted to have this opportunity to meet new colleagues and hope that we can pursue this afterwards. I'm the director of the International Centre of Excellence for Community Schools, and as the name suggests, I work with those organisations that support community schools around the world. But I've been working in particular in recent years pardon me, with NGOs in several of the countries that we're talking about, and together we have produced the International quality standards for community schools, and we've introduced those into our own countries and also into additional countries. And you might be interested to know where those NGOs come from, because I noticed that you put a list of countries, and you'll see that some of them are different and some of them are the same. We work in Armenia, so I'm very interested to hear from Serap and what he's been talking about. I'm sure that there'd be ways for further collaboration there. In Moldova, Ukraine, Kazakhstan, Mongolia, Czech Republic, Poland, and of course with Adina in the Bosnia and Herzegovina area. We are supporting community schools, and community schools are called different names. Sometimes they're called open schools or interactive schools or community active schools. It's important, though, perhaps to recognize that initially in these countries the focus has been on citizenship, democracy, and involving parents in the governance of the schools. When the Soviet Union collapsed, it really did collapse, and I'm sure that Hoof and Sarah Buke will know far more about this than I do, but I have been to the villages in Kazakhstan where they said once the Soviet Union collapsed, there was nothing. There was no milk was coming through, there was no electricity, no gas. Very basic things like that. But in our terms, more importantly perhaps, is that they had no idea about what schools were for anymore. And so the whole value system behind schools has had to be reinvented over the last 20 years. And it seems to me, and I have to say that my comments are going to be from my perspective as I have observed. I have no academic research on which to base my assertions, but it seems to me that there has been quite a focus on looking to the West. And Adina said in her presentation that issues such as social inclusion, for example, is quite a challenge for them. And indeed, this is what I found, because when we put the international quality standards together, I would say if you looked at them, they are very, I would say, aspirational rather than a description of what people are doing. They're a description of how we would like to see our schools progressing in the future. And in so doing, many of the underpinning values, I think, would be recognized more in the West than they might do in the East. So that when you actually come down to the practicalities of what's happening at school level, rather like Adina said, you might have laws, you might have rules and regulations, you might have these standards which people all sign up to, but when you look at the day-to-day running of schools, then quite often there are big gaps. That said, the schools that are being supported by the NGOs are doing many of the things which Serap discussed in Armenia, in that they have programs around citizenship, democracy. They've often had to engage in community development because frequently the school is the only public asset available in a community, and in order for children to be ready to access the curriculum, quite often community development work has had to go on alongside the improvement of the school. They run things like after-school programs, lifelong learning for parents, and they bring in additional services into schools. Quite often those will be health services. But what strikes me in working with my partners in these countries is that, and I don't think they're alone in this really, is that the world is changing rapidly around us. New technology is making a phenomenal difference. Our young people are accessing information that we could never dream of when we were children ourselves. Political change, economic change is rapid and happening all around us. And I wonder to what extent adults are able, and that includes teachers, are able to move as fast as the world is moving around them. For example, we know that one of the issues that many of these countries face is the movement of people. So I'm speaking from the UK. We have had many people coming from Poland to this country. And quite a lot of people from Moldova have gone to Poland as a kind of backstop. This means that in Moldova, for example, there are many families without an adult head of the family, but an older sibling, or many families are being brought up by grandparents. So quite often, the children starting school have no background that enables them to start at a good place for beginning to learn, and a lot of work has to go on with grandparents or older siblings about preparing children to start school. And when you look at, for example, the experience we've had over here with Polish children coming to the UK, some of them then going to urban schools where there are many different races, and expressing extreme racist views. And when I've talked to teachers in Poland, especially in rural Poland, and I ask them, have you prepared your children for moving into the wider world? Have you talked about racism? They have to say, no, they haven't. And I don't blame them for that. They themselves have remained in Poland, and for many of them, they're not conscious of what the society is like that their children are going to move into. And I think for all of us, that the use of new technology is something which is challenging us. It has many opportunities, if only we ourselves, as I'm speaking from the heart here, if only I myself could get to grips with some of it, I'm sure that we could do a lot more to exchange views, to encourage the free exchange of ideas, and as Sarah said, to move people on. There is disadvantage in all the countries that we work with. In Russia, for example, we know that we have a lot of street children. We have a lot of street children in Ukraine. In Ukraine, and I'm sure it's not alone in this, there's an increase, a very frightening increase in the incidence of HIV/AIDS. Yet when I'm working with people from these countries, there's often a lack of what I would call connect between those issues and how that might affect children's ability and readiness to access the curriculum, the impact that it will have on children's readiness to learn. I've just been doing, as Adina will know, editing a number of case studies that have come from Russia, Ukraine, and all these other countries. And interestingly, they've looked at individual schools and how those schools have taken forward one of the standards that we have 9 standards at the moment. And in many of those cases, they've described their local community, but often the initiative that they've taken doesn't necessarily relate to the way in which they've described the community. So there's often a bit of a disconnect, I've found, between people, by that I mean teachers and other people involved in education, recognizing that the society is changing, that there's disadvantage, that there's high unemployment perhaps, but not necessarily making the jump then as to what kind of interventions schools can make to make a contribution to that. And I think one of the issues that Hoof mentioned in his contribution was the difficulties of creating partnership, and I think that's probably all around the world. But interestingly, we have a meeting planned at the end of the month in Sarajevo, and we have agreed to take with us a partner from another organization and create, whilst we're together, some materials which teachers can use. And it struck me then that we're all going to have a go at demonstrating the power of partnership working. So watch this space. I'm hoping that we will be able to get some exciting and innovative work coming from that. I would certainly hope that we can deepen our partnership with health, because I think we're working in very much the same kind of, we're pulling in the same direction. Although I've listed those issues and those problems that I think we're confronting, I would also have to say that I've met with tremendous enthusiasm. Having worked in community schools and in education in the UK for, well, I'm not going to tell you how long, otherwise you'll know just how ancient I am, but for quite a long time. There's a lot of cynicism around here, but I've found such a freshness and such an enthusiasm and a great willingness on the part of NGOs to overcome many of these challenges. So I'm actually feeling, I always come back from meetings with my partners in these countries feeling very much revived myself, because I think that they are really willing to move in these directions of working in partnership with others, making the curriculum more accessible to children, confronting some of the issues that are really difficult, such as that will prevent that, such as discrimination. And I'm feeling really quite positive despite many of the difficulties. So that's my reflections on what I've heard today, and as I said at the beginning, it's very subjective and I have no academic research to back that up. It comes from my experience of working in this region over the last 10 years.
Thank you, Chris, and I think that's a good point to end on, is that I think this whole area of working within contexts is quite new. And I'd like to come back to it. First of all, I invite people who are online to gather their thoughts, and if they have questions in a moment, I'm going to ask you to click on the talk button in the upper left-hand corner to raise your question. If you could just do that, and I will try to follow it fast enough to be able to recognize you. Or if you want to put up your hand, which is if you look under your name, you'll see there's a little raised little icon for raising your hand, and that will alert me to the fact that you're looking to make a point. Otherwise, you can also use the chat box to type in a question, and I will read that question out so people can focus on it as a discussion point in the discussion. And I'm going to return to the four presenters, and first of all, thank all four of them for an excellent set of ideas and thoughts. And I'm looking forward to working with them in fleshing this out a bit. And maybe as I watch for questions and comments, I'm going to take a step back to 2007, when the International School Health Network was asked by WHO in the global office to help with a Canadian conference. That was actually the second of our series of conferences that we've done every 3 years. First one in Melbourne in 2004, and the next one in Pattaya in 2013. And in 2007, we were asked to look at this issue of context, and so we raised a number of contexts. One of them was Indigenous people. Another was disadvantaged communities in high-income countries. Third was countries that have been disrupted by war or disaster. A fourth was low-income countries. And I think we're making some progress, but I think we've really fleshed out how those kinds of contexts generate the capacities and the trends and the issues that then community schools, healthy schools, safe schools, all the different approaches to schools need to address. And so we're working on that, and in our conference in August in 2013, we're going to try to continue the conversation. And I note this because I think it's what was interesting to me is we worked on this notion of countries that have been disrupted by war or conflict, not knowing that there was a huge network of people who are gathered around the banner of emergencies in education or fragile countries who had been working on those issues of relief aid for a number of years. And yet, you know, our folks when we were organizing this, certainly I, but WHO didn't point me to them to be able to say, well, what about working with this network? And so that's one of the things we're trying to do as an international network, is to bring that kind of cross-fertilization. And then, of course, at a regional level, I'm really pleased to be able to see that this regional network may also have this capacity to help people reach across the aisle and learn more, whichever framework or set of ideas they're working with, to learn that there's other folks in the world. So I'm going to ask maybe a comment on the presentations to also stimulate thoughts or questions. I was very pleased to hear Sarah, in quoting Toynbee, talk about the optimism of this century, and it also came out in Chris's remarks about being revived. And so in the draft materials we've been working with, we've used, and Chris and I use this in conversations, the word Renaissance, particularly for the context of countries that are rebuilding themselves after some sort of constraints have been imposed on them. And I think that's really important to have that strength-based, that asset-based, that we can do this kind of start to the thinking. Certainly children in schools are the best place to start about thinking. So in our work with indigenous nations around the world in defining that context a bit, they said, no, let's not start with our problems, we'd like to start with our strengths. And so I think that's important, that we begin with that thought, and then work from there, from that note that there's lots of things that can be done very successfully. And I guess that was one point I heard in the presentations, and the other was that Hoff raised it, and this is true of all nations, all countries. In middle-income countries, perhaps, or in low-income countries, they are chasing the funding from a lot of funders, as we do in high-income countries as well. But those funders are often external to the situation. They're well-meaning foundations, or they're international agencies, and they can, as can happen in large governments and in paying countries, the funders are tripping over each other, or in fact even competing with each other. So I'd like to ask our panel to comment on those two thoughts, perhaps, about starting with a positive and then also about multiple funding sources, which I note in the draft documents we're working with, we haven't really looked at the notion of funding sources. So any comments from the panel about those two ideas? Just click on your mic and jump in.
Hello?
Hello? Yep. Okay, I see also that Adina's having trouble connecting. Adina, if you just wanted to go out of the room and come back in, hopefully we can see you come back in. So go ahead. Was that Chris? Yeah.
Yes. Can you hear me?
Yes.
Yeah. Yes. A lot of the schools that I've worked with, or rather the NGOs that are supporting the schools that I work with, are being funded for the long term by CSMOT, which is an American-based company, and by George Soros. Now, both of those are American companies, American organizations, funding work in schools in Russia and in many of these other countries. And the purpose of them, as I said, was to encourage citizenship and democracy. And so that idea is really quite explicitly expressed in that funding. I should say that from my experience of MOT that also funds us, they have been excellent in terms of having a long-term focus, which is also something that is needed. Those of us in the West that have to develop things through using external funding is often bedeviled by short-term funding. So you get money for 2 or 3 years, which often isn't enough to really embed something into normal practice. But these have been funding for the long term, which is a positive. On the other hand, of course, because it is an external fund, because they are external funders, with that very specific view on democracy, and there have been others that have come from a particularly a specific type of Christian organization into those countries, then they haven't always got such a good name in those countries because their purpose is so specific. And I think sometimes it may feel for, if not the recipients, then maybe for some of those administrations, as though in some way their national sovereignty is undermined by external funding. So I think that there is some kind of tension within that maybe should be recognized.
Thank you, Chris. Further comments, Sarab or Hoff?
I have some comments to make. I think the funding issue is a very interesting one. And, yes, I've come across many funders when I'm in this part of the world, and I can give a very interesting example of Kyrgyzstan, where I was in April, May, that they have set up a whole structure and network of health promoting schools with basically no funding at all, which is, I think, very interesting. And I also noticed that when I went to the poorest schools in the local communities in this country, the money was not an issue, because they are used to the fact that there are hardly any resources anyway. And but from my Western point of view, I think there are huge possibilities for funding, which also are a bit different from charity, but in the European Union there are several ways for funding countries with active support from the countries themselves, which have a focus on democracy and human rights, but also education. And at the moment I'm looking into these possibilities with some of my countries to set up some kind of structural projects that promote health or very broad concepts. I don't really care very much about health promoting schools as such, but when anything we can do to contribute to educational reform, I think is very good, and especially the European Union is interested in that. So I think that's a new possibility.
Thank you, Hoffman. I think I'll jump in with a... Sorry. Just wanted to jump in with a... If you could, with a thought about that, about funding sources, and it was certainly an experience that I've had in one developed country in Canada was that funders are coming with a package that they have to promote because that's where their funding is coming from. And by shifting the conversation to look at the context of the country or the local community, we have to find ways of enabling folks to focus on the issues that matter most to them at that time. I was quite struck with Sarab's presentation about how they've been working with issues around the physical environment of the school and with immediate physical needs in terms of dental health and so on. Whereas sometimes, and this is true right up the ladder of all the different government structures, there might be a trend that they are dealing with obesity or another issue of the day, whereas the local community or the local country knows better what they need to address. And by shifting the conversation towards a context, we can maybe work at enabling, getting funders to enable people to choose the issues that are most important to them. Any comments from that from the panel members?
Douglas?
Yes.
Can you hear me?
Yes.
Yeah. This is. Thank you for raising this topic. It's really very important, country context, because I had this experience of working with different organizations which are kind of imposing their formulas of change, which sometimes don't fit in the context of the country needs and developments. So that's why. Working with co-op, we are kind of trying not just to impose the changes, but also growing this local capacity and finding people whom I can call key informants and change agents. People who really understand what are the needs of this community, and with understanding the real needs, changing the community. That's why one of our main topics in our health education programs is giving schools opportunity to come to us with their ideas and initiatives, so we can support them to implement their ideas. In general, people don't like change. So we should work with them closely in order to make a change which is completely based on their needs.
Thank you, Sarah. Further comments from panel members? Okay,
I can add, Doug,
go ahead.
Maybe I can add something.
Go ahead.
My experience with training. I've been working with students and teachers and parents from the co-op schools and from other schools in Armenia, and we worked on the basic ideas of what is a health promoting school. And I found that it works extremely well. People have a good understanding, know what it means, and I noticed especially in the co-op schools that they are very skilled in being very specific in what they want and how they can apply a whole school approach to elaborating and solving their issues, involving all school community members and also the local community. So I think we can learn a lot from the experiences that co-op has in doing this. So it really works in practice. It's great to see that.
Excellent. Chris, any comments?
Well, only to echo what's already been said. Yes, I mean, I agree. You can't go into a country and have a ready-made package and expect it to be implanted there. That just doesn't work in my experience, and the best thing to do is to work from the bottom up. But I think that even in the most remote areas, people have quite a sophisticated understanding of what they want for their children and what kind of world they want their child to grow up in. And I think you can there's always enough there to work on to develop programs that will help them improve their systems.
Thanks. One comment, one more specific point before we look to finish up at the half hour is, and Adina raised it, and I note that she's had problems connecting back into the room. So, Anera, thank you for bringing that to my attention. But Adina was noting the impact of the history, the history of war in Bosnia. But and I come from a country, I lived in a province where there was a similar history, and lived through some difficult times, and with firebombing of my office and a few other things. So it can happen anywhere, but even on a more mundane level, the history in a community, in a country, will have a big impact. And so where we can bring together countries that have similar, not the same, but similar histories, and how they are working that through in their own negotiations with their communities and with their governing authorities, I think is another kind of area. And so, Sarah or Hoff or Chris, comment about how local histories can influence the future, and are there similarities in the history of these countries in Eastern Europe and Central Asia that have some similarities that we might be thinking about as we look forward to health and community development programs? And maybe if we could comment in these, and then we'll look to close up the session.
Just briefly, all the countries that are in Eastern European and Central Asian part of the world have been part of the Soviet Union. So they share a 70 years history of an extremely top-down approach to education, where in Moscow, in every detail, it was decided, what class, in which country, at what time, at what age was learned. And also you recognize that in the school buildings, they are basically all the same in all the countries, in my experience. And so they share a lot of that history, and I think it's good to acknowledge that, and that there is a huge sense to get away from that and to step into more open and transparent and democratic ways of teaching and of organizing schools. I think that's something we could use more. And I think also that we, for example, with the coordinators that we have in these countries, these people are really active in their work and their fields, and we could explore their expertise and knowledge more, despite the language or cultural issues that makes it sometimes more difficult. And we'll highlight some of these experiences in our European Conference on Health Promoting Schools in October in Odense, where Syrup will be one of our keynote speakers, and I think that's a great development. Thank you.
Thanks, Huff. Chris or Sarah?
So I think I will agree with Hoff on the topic that most of the countries have Soviet past. So, and this is a common thing for all our countries. We have same problems, and I had an experience of working with the different experts from former Soviet republics, and really the problems mostly are the same, challenges are the same, because it was a kind of authoritarian country, and it kind of molded the same thinking stereotypes. And one important thing is that we should not only look at our past and finding some similarities in our history, but also looking to the future and kind of moving forward.
Thank you, Sarah. And Chris?
Well, I think really just to say what I said earlier, which is, yes, they have had that common history, but they do share a common enthusiasm and a thirst for learning more, for trying out new ideas. And certainly amongst the NGOs that I've worked with, there's a tremendous eagerness to be very active and to bring as many schools into the fold as possible, and to introduce new ideas. And I think that's a real asset and a real plus.
Great. Thank you very much, Chris. And maybe as we close up the session, to point people to the two documents that we've been working on. They're on the screen now at the bottom. If you could look at the schoolsforall.org website, we've tried to identify some of these thoughts into a bit of a short summary. And if people online or people who come to listen to this recording can take a look at those and comment on them, we'll be noting them again as we send out the link to the recording for this session. And as I said earlier, we're anticipating that in fact, the 400 folks over 400 people that we invited to this regional conversation, I think all of them are interested in following these conversations, and many of them will be going both to the recorded sessions and to the slides from the session, as well as I hope to the notion of the Wikipedia-style conversations as well. On your behalf, on behalf of the participants and the folks who are going to be doing that reading, I'd like to thank our presenters today, and thank them very much for their contributions as panel members, and looking forward to their further discussions. I will indicate that we're going to be looking at doing a second webinar for the regional European session, probably in the fall, early fall. We're going to next step in terms of the regional network is to invite, and I've already had requests from 3 or 4 pan-European networks to come together to be more actively involved. And so Hoff and Chris, although your mandate is global, you might want to be engaged in the conversation as well, is to have a sort of a planning meeting about what topics could be looked at. And Hoff, maybe we could link that up to your session in October in some way, so that it can be helpful having some sort of face-to-face participation as well. So we can follow up on that with a separate email, but I'm very pleased to note that of the 400 people, everybody seems really interested in these European conversations. And I maybe close on with an observation of my own about, at least in terms of health promoting schools and its development in different parts of the world. I was actively involved as Chris and Hoff and others in the late 80s and early 90s as we developed this concept of very much similar to community schools, but a bit different, or safe schools, a bit different, and noted how it evolved in different ways. Even in North America, the Canadian experience was we ended up looking, in typically Canadian ways, we looked at trying to find ways to agree. It was muddled and moderate and middle of the road, but that was what we were trying to do, and so we emphasized in our little definition at the time sort of cooperation and collaboration. whereas the Americans, they were much clearer about their programs, and their model was an eight separate programs that they were linked together and specifically identified and worked on very well. And then I looked to Europe, and it was a lot more about values and culture and democracy. And if you look at the language of those statements, that was the strength from Europe. And so I am looking forward to the European region offering more leadership around the world, and looking forward to being a listener in on those conversations. So on your behalf, I'd like to again thank our four presenters who are took the time to prepare and to make their remarks today, and we'll be closing up the session. If people could, and I'm just going to turn off the recording now just to do that, if I can find the right button.